So, good morning, Earl. We're live. Thanks for joining me on this Friday morning. So, if you don't mind just introducing yourself, I know you have some pretty lengthy experience in the healthcare space about kind of your career background and then the companies you're building to help tackle various problems with the healthcare system in America. That'd be great.
Okay. Well, thanks you for having me, Connor. In terms of background, got a lot of gray hair here, so I've been around. But by education, I have an accounting degree, and but however, I've been in technology almost my whole career. It dates back even to telecommunications, and then in the '90s, e-commerce, primarily B2B e-commerce. And up until 2003, other than dabbling, of course, I've been in Nashville, Tennessee for a long time. And of course, Nashville is, by some people, call it the Silicon Valley of healthcare because there's so many companies here, especially on the for-profit side. But it even influences the not-for-profit side also because you've got big stakeholders like Vanderbilt and so forth that are here too. But really, other than dabbling, it hadn't been in healthcare. And then in 2003, myself and a partner of mine, we founded a company called nTelagent. And what nTelagent ended up becoming was kind of the first holistic retail application at the point of service for healthcare. So what it would do, it would tell a registrar or financial counselor exactly what a patient owed prior to service. So we tell them whether they qualify for charity or not, whether they, whether the provider would offer them terms. It had payment processing built into it. It would tell the registrar, what to say, what to do, and it really helped a lot of the providers. Because at that time, the providers really weren't asking for, money from the consumer, and how we kind of got into it was actually talking to some providers. Providers said, "Well, look, Earl, can you develop something that can help us with our bad debt situation?" And they really thought that the problem was, the uninsured. Well, it turned out that when we developed this platform, we developed some capability to run age trial balances through the system. What we ended up finding out was it really wasn't the uninsured that was causing all the problem. We ran a big provider through the system, and it was about 60% were insured people that were, causing their bad debt problem. And then from that evolved the system that we described. So, and we grew that company up, and we helped. It really started out in community-based hospitals, of which that's still the majority of hospitals in the United States. And of course, a lot of rural hospitals. And we actually saved a lot of hospitals from closing because, they needed the cash. And it was also helpful for the consumer because the consumer could get prompt payment discounts. And, they had a provider that would work with them in terms of, if they owed money that was out of pocket too. So after we grew that company up in 2014, we sold that to a company called Availity. And if you're not familiar with them, they're they were at that time was a joint venture between a bunch of the Blue Cross Blue Shields and I believe Humana owned a piece of it, possibly even Aetna. And after we sold the company, and of course deductibles had been going up for a long time. But the Affordable Care Act seemed to really, for lack of a better word, put things on steroids. And so what my partner and I said was, well, look, what we really need to develop, we both had an e-commerce background back in the 90s, is to develop a e-commerce platform for healthcare for all the stakeholders. So we started to develop that because, the cost of healthcare now is unless a patient is chronically ill or has some kind of catastrophic event, then the patient's going to owe all the money now, because family deductibles now it's not unusual for the family deductibles to be $10,000, and if you look on a gross basis, because the industry still they have they have gross income and they have net, if you will, income. And the gross income is kind of like, I compare it to, if you go to a hotel, you used to go to a hotel, you'd look on the back of the door and they would say, oh, this room costs $400 a night. Well, I got it for $95. So what's the difference? And that's the difference. And that's pretty much the way the industry has, accounted for things, if you will. So anyway, what we're doing with HealthQRS is to build a platform that's not only transparency, because the platform itself has some 23 microservices that can work individually or work with each other or work with other third-party systems to be able to create a marketplace. And a marketplace can be defined however you want it to be defined. So a marketplace, let me use an example since I'm here in Nashville. If Vanderbilt wanted to develop a marketplace, then they could develop a healthcare marketplace where they could have not only all of their facilities, as well as if they wanted to invite partners also, then they could invite partners that would be able to participate in that marketplace. And then they can invite the consumers to be able to basically have an easy experience, because that's one of our objectives with our platform, was to create to take the complication out for the consumer in terms of purchasing healthcare, because it's still really complex with the consumer. I mean, just in my case alone, and I've been doing this for 20 years now, just having procedures done and then getting the bills right, it's a nightmare right now. It just is. I mean, I recently had a procedure on my eyes. I had a torn retina, and I had appropriate insurance. I knew I'd already met my deductible, and guess what? I got bills that said that I was out of pocket. And so, for the average consumer, I mean, they don't know even how to handle about that. And so, let alone what the price was to start with, or quality of service of the provider, and so forth and so on. So, that's one of the objectives that we were trying to do with the consumer, is make it easy on them, but at the same time, for the provider, create a marketing tool for them. Because what's happening in the market right now, because the cost has gone up so much, I think there was just a publication out just this week that showed that in 2022, the healthcare industry is $4.5 trillion now, which represents somewhere between 18-19% of GDP of the United States. And it's projected to go next year over 8.5%. So what's happening is the consumer is delaying procedures. There's a recent study that was out that showed that 40% of people are delaying procedures because they don't know what the cost is. And if you look at this, of that 40 insured people, okay, so people that have got jobs, people that have insurance through their companies, and they're not having procedures done. Well, I mean, what does that mean to the provider? Well, to the provider, that means that there's hundreds of billions of dollars they're setting out there, because, the consumer doesn't know, well, I'm going to owe $1,000 out of pocket. Well, they don't know that the provider might give them terms and let them pay that over 10 months or 15 months, or, whatever the case may be. And so they're just not having the procedure done, and which is not a good thing. And so, what our platform does is it removes all that, and it provides that marketing opportunity because, if you just took the hospital market alone, in 2022, that was a $1.4 trillion marketplace. Well, for them, if they've got 25% procedures getting delayed, I mean, just do the math. What's that, over $300 billion
Mm-hmm.
that they're losing out, let alone outpatient surgeries, physicians, and so forth. So, so what we're trying to do with the system is make it a win-win, a win for the provider and also a win for the employers and employees. Because an employer plan now is, let's take, for example, just the premiums alone. Okay. The employer's portion is a little over $15,000 now per employee. And then the employee is a little over $6,000. Now, that doesn't take deductibles into account. So if you take deductibles into account today, the cost of healthcare for a family of four is over $30,000 a year. Well, I mean, that's just not sustainable. I mean, it's not sustainable for the employer. It's not sustainable for the consumer, and quite frankly, it's not for the providers either. Yeah. Or the payers, as far as that's concerned, because at some point, and the system's already breaking now. I mean,
Mm-hmm.
You're seeing it. When I started nTelagent back in 2003, it was unheard of for a hospital to close because legally it was so difficult within a state to close a hospital. Now you're seeing hospitals close almost on a monthly basis, not go bankrupt. You got many more that are going bankrupt. And that was a rare thing too when I had started nTelagent and even into it. I remember my first bankruptcy was probably around 2011, I believe it was, that my company had a relationship with one that actually had to go bankrupt. But again, it was really, really rare. Now it's not rare at all. And in fact, we've got over 1,100 of our community hospitals that have one or more, financial red flags. If you look at their financial statements, cash on hand,
Mm-hmm.
they've got negative operating margins, whatever. And you have approximately over 600 that are in the short term, and by short term, probably within 2 years, they'll go bankrupt. Which, if you're familiar with the hospital market, if you take out the VA and all that, we got about 6,000 hospitals. So you're talking about losing 10% of the hospital. So the provider market has got to change the way they're doing business, and the employers themselves, they've almost reached a breaking point.
Yeah. So I want to call out a couple points. I think you made a lot of good points there. The first thing I think you mentioned, for a family of four, in certain instances, you're seeing them experiencing a $10,000 deductible. So for people out there that may not be an expert in this space, I mean, just understanding that you pay $10,000 out of your pocket until the insurance covers anything at all. And I think just the understanding that, like you said, an outpatient surgery or a minor operation can cost thousands of dollars. And then on top of that, you are paying the monthly premium, right? So I guess my question to you is that, I mean, is that even insurance anymore, right? When you have to pay so much out of pocket or such a substantial portion of your income, I mean, when does it, not become insurance? And I think you mentioned it as well, that employees are being burdened. Do you see a point when employers say, this isn't even worth it, or this is too much of an expense, I'm just going to have my employees figure it out on their own? Is that a trend you're seeing, or do you see that happening in the future?
Yeah, Connor, it's not future. It is actually happening. I mean, some, especially on the smaller employee market.
Hmm.
So the ones that aren't self-insured, generally, for everybody out there, if they're not in healthcare, generally, if you've got, and that number has gone down because there's ways you can self-insure or partially self-insure yourself, but fully self-insured. If you got 500 employees, then you're probably self-insured, which means you may have some third party that's doing some of the administrative functions, but you're writing the check. Okay. If you're an employee, but on the below that number, you're seeing a lot of employers go because what, you know, corporate America, what they're paying is less because they've negotiated better rates. These smaller ones, they're paying even higher rates, okay, than what
Hmm.
I just described. And so in their case, what they're doing is they're just saying, well, look, I'm going to give you X amount of money, and then you go buy your health care. That's happening right now, and you're seeing that more and more of a trend, which is really not solving the problem at all. And to your point, no, today we really don't have insurance. We have insurance, but we have catastrophic insurance is what we have.
Hmm.
But we're
Yeah.
paying, but we're paying rates that aren't catastrophic. Yeah.
Yeah. So can you speak to it? I think the reason we need catastrophic insurance in the United States is for whatever reason, God forbid you're in a car accident or a freak accident occurs and you need to spend a few nights in a hospital or a week in a hospital. And next thing you know, you're looking at a $100,000 bill. And I'm curious, just knowing your background, why do hospitals charge so much, right? I know on my side that a night in a hospital can be 4 or 5 grand, regardless of the other services provided. And so why is it so expensive? Because I think part of the cost definitely lies with the providers in that they are just charging so much. And then when they charge that much, it requires the premium to go up and the benefits to go down for the payer, for the insurance company to continue to offer a plan. So I don't know if you have any thoughts on that. I mean, why does it need to cost so much for an operation or to be hospitalized in the United States? Because I think that's a big part of the issue as well.
Yeah. Well, the reality is it doesn't have to cost as much, and what you're seeing right now is in the market. I mean, some of the providers are finally figuring out that the consumer's kind of smart, getting smarter, if you will. And they're also seeing the delay in procedures because you still, we haven't recovered, okay, from COVID. So in other words, the providers themselves, they're not at the same capacity that they were prior to COVID. And so what's happening is um, they're having to find other ways to lower cost, okay, and make more procedures outpatient, procedures, so the patient can go home quicker, and the cost, can be lowered. You're seeing that right now. I mean, operations that you used to, stay 3, 4, 5 nights, you're only staying one night, or in some cases, you're just only being observed. I mean, they're doing things in heart surgery now that you would have once had to spend several days in, and now they're just observing you for so many hours, and then they're letting you out. So some of that's happening, but still the cost is continuing to go up. Some of that is an administrative cost. Some estimates, and I think it could even be higher than this, that we've got about 30% administrative cost right now that's baked in that it could be taken out. And one way it could be taken out if we really did have real catastrophic insurance. So I mean, you'd be very limited. Maybe the deductibles would be even higher than 10,000. And then you could also remove some of the requirements, if you will. one of the problems with the Affordable Care Act is that it required in the plan for you to cover procedures that normally, like a young person, just would never do. Okay, or if or certain procedures that the majority of people wouldn't do. So if you kind of unbundle all that, then the payer, if you will, doesn't have to worry about, well, that's a requirement that I'm going to get hit in, and that further drives the cost up, if you will. And as I said, the administrative costs. But you are starting to see some of the providers when we were first talking about consumerism's coming to healthcare back in 2014, 2015. The consumer was ready, but the providers weren't, and that's one reason you've seen pushback on transparency, if you will, in pricing. But now you're starting to see, if you read the healthcare publications, you're starting to see them. They don't call them patients anymore. They're starting to call them consumers, and they're starting to come up with different models, because that's what it's going to require. It's going to require different models, and even at-home care too can help lower costs, whether it's acute care or whether it's post-acute care, and for the aged too. You're going to see more and more moving to home health care because, well, for several reasons. Number one, the baby boomers don't want to go to a nursing home. Number one, but also it's a cost issue too. Mm-hmm. So I hope that kind of answers the question.
Yeah. No, I think it makes sense. And I think you made a good point there. There's something I've thought of, is you mentioned like true catastrophic insurance. I think it would be interesting if you could offer, and again, this is prevented by the Affordable Care Act, but kind of stop loss insurance where you say if you're hospitalized or, unfortunately you have cancer or anything that is going to require high cost treatment, that a plan covers things like that. But then, as you mentioned, with consumerism, I think there's an opportunity for more competition for routine services, where I think in a perfect world, to see your primary care doctor, you could just go pay out of pocket, and there's no, there's no insurance, involved, where you, like you said, I think with the platform you're building, for example, you could look up online and say, oh, this PCP will see me for $40 all in. And this one over here will see me for $60. So I'm going to go to the $40. I think for things like that, or lab work or MRIs, it could be much more price driven and consumer driven. And I think, to your point, that's the reason why Americans can't go uninsured, is the threat of that looming $200,000 hospital bill if something tragic happens in their life that can completely financially ruin them. So I don't know if that made sense, but that's just kind of a something I've been thinking through, is like, how can you change the system, right? Because it currently isn't working in its current state.
Yeah. Well, and if you think about it, again, talk about me, I was, when I was young in the 60s, okay. And what you actually had was catastrophic insurance. I mean, you paid out of pocket if you went to your doctor. I mean, there wasn't this, umbrella that we have right now, that we call insurance today. You paid if you went to the doctor, and then you had this catastrophic insurance if you had to go to the hospital for, some catastrophic event. So if you had an accident, or if you had a heart attack or whatever, then it would, it would cover that. It's kind of like the analogy. What we need to get back to is like with a car. Okay. Well, your insurance on your car doesn't cover for your oil changes, or for you to get new tires, or to, have your lights replaced when they go out. Right.
Yeah.
It doesn't. Right. And so, what we need to do is get back to that, and and create, you know, more responsibility, if you will, because part of it is also the consumer. I mean, it's not just the providers just trying to make money, you know, and people think they're being greedy or whatever. It's you know, it's also the consumer to be responsible. And you know, I think what happened with the consumer, they kind of got lulled to sleep over a long period of time, because you know, I can remember, and it wasn't that long ago that, you know, a family deductible was $500.
Mm-hmm.
Well, I mean, $500, and you got to pick your point in time. And that goes back in the 90s. Okay. I mean, I know maybe for you that seems like a long time, but it's not, it doesn't seem that long time for me that it was, you know, $500. And prior to that, it was even less. And so as a percent of your income at that time, it was really nothing. Okay. And then over time, through a lot of different reasons, cost has just gone up, up, up. And of course, it's gotten laid off to the consumer. But again, it had to get this high for it to kind of get to a breaking point. But I think, you know, there was a period of time where people got lulled to sleep, and they felt like, hey, this is owed to me, you know. This is, you know, this is part of my benefits that I really shouldn't have to pay anything for healthcare. Well, healthcare does cost, you know. I mean, there is a cost associated with healthcare, but it's not it's not for the average family that's got a family of four. It's not $30,000 a month. It's I mean, that's and the government is projecting that by like 2031. I mean, we're looking at it being over $50,000.
Yeah.
I mean, that's just that number is just, we're talking about over $4,000 a month. I mean, my gosh, that's just an astronomical amount of money. I mean,
isn't, and I think it'll be different with inflation, but I mean, at that point, it's almost like the median income for an earner in the United States. Like every penny of their income just goes to healthcare, which doesn't make sense. Can't work, right?
Yeah, Connor. I mean, you're right. I mean, it's not sustainable. That's the reason that things have got to change, and you know, and there's been some attempts by it, but yeah, I think what's happened is nobody has used a new approach, if you will. So, let me give you an example. Back in my last company, that we had, I would have more than one provider tell me, they said, Earl, you know, if you were in the industry, you'd have never come up with this solution. Okay. Mm-hmm. Now, not to say that you can't necessarily be in the industry and create solutions that work, but you know, if you'll recall the joint venture that Amazon and JP Morgan did in healthcare, and with I just went blank, the third company,
Berkshire Hathaway.
Yeah, Berkshire Hathaway. Yeah, did was they were trying to, you know, break through and create this, you know, new paradigm in healthcare, especially for the employer side. And there were many reasons that they failed. But one of the reasons that they failed was they didn't make it easy for the employees to purchase healthcare. And they were basically taking the same approach that's out there in the market right now, is, you know, just build a network and they will come. Okay. Well, you can build a network, but if you don't make it easy for the consumer to see what that network is, to see what the quality service is, to see, hey, here's what my out-of-pocket cost is going to be. You know, they'll give me terms. Oh, I don't know exactly what I'm looking for. I have a system that'll navigate me where I need to go. Okay. See, they didn't offer that. That's one of the, it's not the only reason, but it's a major reason that failed, completely failed. and they had to, just raise their hands and say, well, the healthcare industry defeated me, because they didn't think about the consumer.
Mm-hmm.
So, and our approach is to make it easy to consumer, but at the same time, give all the tools that the providers need, because at the end of the day, these EHR systems, I mean, they don't have good revenue cycle built into them, and so as a result, it creates a lot of these problems for consumers, especially on the back end, like what I just described with you with my eye operation. That I knew I'd met my deductible, had met it many months before I had the surgery, but I was still, and I had secondary insurance and all of that. And I was still getting, and this was from a major provider. I'll protect the guilty here and not mention names. But in their case, they were still billing me for something that I didn't know. Yeah. And a lot of that's got to do with the fact that they were depending upon that revenue cycle dependent in that EHR system. So, because, if you correct the problems on the front end, a lot of these issues that you have with claims denial and so forth, if you get things right on the front end, you remove like the majority, probably at least 80, maybe even as much as over 90% of the issues on the back end. So, I mean, if you don't get certain things right, demographic information right about the provider, then that the payer will probably deny the claim. And also for the consumer to know, where I stand, and I have a health savings account, so I can use, a health savings account. I mean, it's kind of it's all of that, if you will, that needs to happen, and the provider needs to win out of it too, because they need cash. I mean, if you've seen some of the recent scores, I mean, you got really big providers that are getting downgraded on their bonds, and for them, that's a lot of money, because they've got facilities and they're paying out. And for some of these guys, they've got loan covenants, and if they don't have enough cash on hand, then the bondholders can call their loans.
Mm-hmm. I mean, so could you speak to why it's so difficult for providers to collect the money that they're owed? I think you talked about it earlier. I mean, I think a part of it is that certain patients or consumers just can't afford to pay for the services that they were provided. But then I think you also kind of touched on it too, and I think it's a pretty incredibly complicated process, is just that kind of dance that the provider does with the payer to try and get the claims processed and paid in the manner that they want them to be paid. So are those the two pieces, or why are providers struggling so much to collect
well, they're struggling for several reasons. Number one, what we talked about earlier is they're struggling because there's a lot of money that's setting out there that they're not getting. I mean, nobody's getting it because the consumer is just closed their wallets, right? Okay, so you've got that element, but then the people that are actually having procedures, I mean, what's happening is first of all, the consumer, and we're talking about the average consumer. I mean, both you and I are in the industry, so we can over time kind of work through this stuff and know our position. But the average consumer doesn't have a clue, because I mean, this stuff is complicated. So you've got to remove that complication out of the system. If you saw our platform, you'd go, oh, you created the Amazon for healthcare, or the Expedia for healthcare, or whatever. Well, you've first of all got to, through that, educate the consumer so they know what their responsibility is. And they've got to know prior service. I mean, at scheduling, they need to know exactly. And the provider needs to be able to tell the consumer, and the consumer says, well, I can't afford picking up $1,000. Well, then the provider, and I don't know of any providers that don't do this, will say, well, I'll give you terms, and you can pay it over 10 months, or pick a period, if you will, and be able to do that, so that you remove that. Because what's happening right now is, if that money, as soon as that patient leaves, okay, if they go through the collections process, so it's early out, primary, and secondary collections companies, and there are a lot of healthcare collections companies. Then what the net is, once you take the collections cost into account, what the net is less than 15 cents on the dollar.
Wow.
Think about that. Less than 15 cents on the dollar. Okay. So that's one issue that needs to get removed, and it'll solve a lot of the problems. Also, making sure that you've collected all the information up front, that you've got all the demographic information correct, that you've got age of birth. A lot of payers, if you don't have that birth date right, they're going to deny the claim. Okay. That you're verifying that person, is, who they say they are. That you're also verifying that they may have a secondary insurance. Okay. And what's primary and what's secondary too. So you get that straightened out, who gets billed what, if you will. And that will clear up a lot of the back end issues when it comes to then filing a claim and getting it approved. Also knowing up front, well, this procedure needs a prior authorization. Okay. So I've got to get a prior authorization before I do this procedure, and have it approved appropriately. And there is some work that's being done in that area, but and that's a complexity within itself right now. But all of those things can help not only the consumer, but can help the provider in a huge way. And at the end of the day, it could help the employer.
So can you kind of clarify, because I'm getting a sense of what your platform does, but if I'm understanding correctly, you mentioned earlier the Amazon of healthcare. So if I'm a consumer and I log into your platform and I say I need a retina operation, I could search for it and it's going to say, okay, these providers in your network provide this service, and here's the out-of-pocket cost it will be for you and whether it requires prior authorization. And then from the provider side, it will say, oh, Earl Winter would like to receive this service from you. Here's all of his demographic information and his insurance information. So that way the consumer knows how much they will owe out of pocket, and then the provider has everything they need to build a proper insurance company and collect their revenue. Is that a fair assessment of what it does?
That's part of what it does. I mean, that's part of what it does. So what it's doing is it's removing all the complexity. So, when you see it, you'll go, it's like shopping on Amazon or shopping on Expedia. And it's that easy, but there's a lot of moving parts going on that makes it, easy for the consumer. So if I'm a consumer and I don't know what I'm looking for, then I can answer a few questions and it'll take me to where I need to go. Okay. So what service do I need if I don't know what kind of service? So, it's taking that away because, for many people, that's, it's kind of overwhelming for, the average consumer to try to figure all this stuff out, if you will. So, it does that, but at the same time, it also provides huge benefits for the provider because they're able to collect the money up front. Because what's happening right now, because bad debts are continuing to climb for providers. What it does is it takes that away. They get their cash up front and lowers their bad debt, which in turn, you talk about healthcare costs. Hey, you're paying right now in your premiums for bad debt. You may have never thought about that before, but you're paying for that right now in your premiums. because of that inefficiency that's built into the system. So it kind of removes all that complexity, and it's different. It's more than just transparency. You've got transparency solutions out there, but a lot of the problems with a lot of the transparency solutions is that they're giving, okay, here's some average rate. Okay, well, I don't care what the average is. I want to know per my plan what my actual out-of-pocket's going to be. Now, in general, it may be somewhat helpful into you to get a general idea of what things cost, but it may not be that with your plan, because your plan's going to be different than what's built in some of these what I'd call kind of generic transparency solutions, if you will.
Okay.
And then it's better than some out there that have done kind of, I call them kind of the blue light specials, if you will, for healthcare. So what they're doing is they're kind of reselling some excess inventory. So it kind of goes beyond that. It kind of gives you a one-stop shop for healthcare that benefits the consumer, the employer, the provider, and can even help the payers themselves too. And it also can make the providers and the payers compliant too. Because I don't know if you're aware, but it's just went through the House. There was legislation just passed. It was either yesterday or day before yesterday. It was bipartisan. That it's now a law. It's not just a regulation, if you will, by Health and Human Services, because with the way this was passed, the Senate's going to pass it because there was only like 70 people that voted against it in the House. And of those that voted for it, a lot of them voted for it because they wanted it to be even more stringent upon the providers and the payers about transparency. So, I mean, it's a law now. That you're going to have to provide transparency to the consumer. And the reality is if the providers would embrace that instead of trying to put a stop sign up against it, what they'd end up finding out is they'd get more business.
Yeah, right. Because I think you mentioned that consumers are struggling or not even seeking services because they don't know how much they're going to pay, and they fear getting that bill in the mail and being sent to collections, and they say, this isn't worth it. So I think then the provider loses out on revenue. I want to ask you one other question, because I think this is really important about the healthcare costs in America. So I know from my perspective that Medicare as a payer, when they're paying providers and hospitals, I don't know, you may correct me if I'm wrong, but I think it's like 80 cents on the dollar or less. So I think overall, Medicare is not sustainable as a payer or a revenue source for hospitals and providers, right? They essentially lose money by seeing Medicare patients. And the current system, that is subsidized by the employer market. So your employer coverage is subsidizing Medicare. We're talking about how for employers and employees, it's becoming so expensive, it's kind of unsustainable. So I think it's just interesting that if the employer market kind of fails, it in turn puts the Medicare system under threat too. So I don't know if you have any sort of perspective on that or how that is resolved going forward, but I think that's a big piece of it in terms of the cost and the sustainability is the fact that private insurance subsidizes Medicare, and it didn't even bring up Medicaid, but Medicaid pays even less. So I think that's kind of a conundrum we have to face as well, and providers have to face, and the government needs to face too.
Yeah. Connor, I absolutely agree with you, and this goes way back, even back in the nTelagent days. We were bringing up, hey, in the industry, we're trying to say, no, that's really not happening, but it's been happening for a long time. That the commercial market was subsidizing the Medicare and Medicaid market, and the government's made it even worse, because what's happened, and this is part of the accountant that comes out in me, because they've created these advantage programs, and now the rates on some of those advantage programs, I mean, the providers, I don't know if you've seen lately in the press, they're just not taking anymore. So there are different kinds of Medicare, right? You can have your regular red card, and which is true Medicare, okay, and then if you've got a secondary, then that pays a rate that actually a provider can make some money off of, okay, if they're but what's happened is the government has almost kind of shifted a big percentage of the Medicare population to almost an HMO kind of marketplace, if you will. And what that's done is he brought the rates lower. Okay. And so let me give you an example. For these community hospitals, if they don't have at least 35% commercial, then they can't stay in business. They just can't. So that's to your point. It is being subsidized. So that's all got to change. If it doesn't change, well, it's changing already. I can just tell you, because the employers are not going to continue to pay 300% of the Medicare rate. They're just not. Because number one, they can't afford to keep paying it. If you talk to most CEOs and we're even talking about larger companies, not the smaller companies, they're paying even more. Okay. But if you talk to them, because Fortune 100, maybe Fortune even 300, 400, 500, maybe, are still paying about 235 to 240% of the Medicare rate, which they think is high. But if you get below that, which that's where most of the employers are, they're not in the Fortune 500, right? In fact, small business makes up 2/3 still of the employee market. They're paying you more, and they are demanding that costs go down. I mean, this issue, and if a CEO looks at their P&L now, their second highest expense now, besides payroll, is healthcare. So, I mean, there's the model's got to change, and we believe with our platform, and that's one of the reasons we created it, was sometimes this can be an ugly word, but it's to disrupt the market, so that and because it needs to be disrupted. Because if it doesn't get disrupted, it's going to be not only bad, continuing to be bad for the employer and the consumer, it's going to be really bad for the providers, and eventually be bad for the payers too.
Yeah. And I don't know if you want to expand on that. I know you don't have a crystal ball, but I mean, where do you see healthcare in America headed over the next 5 years, let's say? Are you optimistic, pessimistic? I know, like you said, you're developing this technology to help, but I mean, where do you see it going? Do we just continue trending in the direction of higher and higher costs, or are we, as you mentioned, ripe for disruption or a major change?
Well, I guess, from being optimistic, I'm starting to see more providers, and I think it's more than lip service too. You were getting some lip service even maybe a year and a half or two ago about, well, yeah, maybe we ought to start calling them consumers, not just patients. They are consumers. So that was a good thing. But now what you're seeing is you're starting to see some meat put on the bones, if you will. So you're starting to see them doing some different things to bring their costs down. So be it at-home healthcare, wearables that are that do detection to try to do prevention, as well as to monitor people that have gotten they have some comorbidity that they're monitoring. So you're seeing more and more of that. And also what you're seeing more and more of that, you're seeing more procedures getting pushed out, if you will. Now, they may be in a hospital setting, but they're being billed as outpatient surgery. So we're seeing, more and more of that. So that's from the provider side. I think what's really gonna make things different is for the employers themselves to gather together and say, look, we ain't gonna do this anymore. And
Yeah.
you know, here's our platform or some other platform. We're going to use this. Do you want our money or not? That's really what's going to take. And that's kind of where we're at now with our platform, because the employers have just reached a breaking point where they just can't, they can't charge more for their widget or more for their services to pay for the healthcare costs. And at the end of the day, they need to keep their employees healthy too.
Yeah.
And them delaying procedures and all that makes an unhealthy employee. And so I really think it's going to be, there's some people that's going to embrace some change from the provider side. Some aren't. And the ones that don't embrace it, they're not going to stay in business. They're just not. You're just going to see more and more bankruptcies happen if they don't change the way they're doing business. And then on the employer side, they're just going to force the change because at the end of the day, they're really controlling the pocketbook, which in turn I think could also help force change with what we're doing with Medicare specifically. Medicaid's a completely different ball of wax.
Yeah. No, hey, I like it. I think you're right. Something needs to change, and hopefully the economics of it or the market will force something to change fundamentally. So I think that's what we can hope for. But now I want to pivot. I know you wanted to speak to this too. I think you have another venture that's in healthcare, but kind of a different area, but I know a very important area that's top of mind for a lot of people right now, and that is the mental health space. So maybe we could close just with the discussion on that and what you're building and why you're passionate about it.
Yeah. So the mental health space, this is from personal experience. Okay. I have family members. I have a couple of children that have mental illness, and they were both diagnosed when they were teenagers. And mine, because you see the gray hair, my kids are grown. And what I realized over time was, for family, friends of a person that has mental illness, there's no place. They got to figure it out on their own. There's really no place for them to go help that child, help that sister, help that brother, help that fellow employee with their mental illness. Because what we found with our children and with other people that we come in contact as a result of that it goes way beyond just going to a psychiatrist or going to psychologists. At the end of the day, even if you can afford that, okay, because psychiatrists are very expensive and they're cash only business. You're only getting that for 30 minutes or an hour a month. Generally, that's what's happening. And and at the end of the day, the person's got to live the rest of the month, right? And so they've got to have a support infrastructure to be able to do that, to live, somewhat of a normal life. And of course, mental health is just becoming a bigger and bigger issue. Prior to COVID, 28% of all people in the United States were diagnosed with some kind of mental illness. That's prior to COVID. Now, after COVID, it is, and that's diagnosed. So think about undiagnosed. I mean, we're probably pushing 50% of the people now that have some, type of mental illness. So, what it's doing is it's impacting the whole country from a productivity perspective. I mean, just, from just living every day, if you will. And so what we're going to do next year is, and it's a company called Your Safe Harbor. is create a platform that support infrastructure for the family, for the friends that help support that. What has come out of COVID that's been a real positive thing is there's been a bigger push for telecounseling and so forth. It's very helpful, but still, there's really nothing being done per se. There's no place for me as a parent or me as a brother, sister, whatever, for me to go and find out, okay, how can I help my child? They're bipolar. What do I do? They're depressed. What do I do? And so we're going to create that platform that's that easy platform that creates that creates that, for lack of a better word, one-stop shop, if you will, for help.
Yeah, I think that's a good idea. And I think you address something that you mentioned that others don't, even the online therapy or whatever it is that that's just a very minuscule chunk of your month. But then the question becomes, who is close to that person and who can help them just in everyday life, right? So is that kind of the reason behind it? Is that you feel like that's the key to helping solve this issue is through families, close friends, and things like that?
Yeah, it really is. It's for the person to live a normal life, they've got to have a support infrastructure, and telehealth piece is just such a small fraction, or the counseling is just such a small piece of the equation. They've got to have that, and what about people that maybe have a small family or they're just kind of out on their own, a platform where they can go, because they may have just a child and it's just them and a child, to be able to expand that, to get help from other groups that share the pain that they're going through right now, or the challenges that they're going through. So, yeah.
And I don't know if you have an opinion on this, but you mentioned it earlier that, I mean, even before COVID and since COVID, I mean, the spike in mental health conditions has gone up. And I don't know if we want to be quoted on it, but I mean, if you're approaching close to half of the population is having this condition, I mean, do you think it is indicative of a larger problem, or, what's the root cause of this? If you think back to in the 90s, maybe this wasn't such an issue. So why is it such an issue now? I don't know. Do you ever think about that or have any ideas about the driver to this?
Well, if you go back to the 90s, even, there was a shame factor, okay, of even admitting that you had a mental illness. Okay. If you go back to my age, a person that might have a mental illness, it's not the same percentage. It was a lower percentage, but you would hear the old thing of of the eccentric uncle or whatever. Over time, and especially with the Z generation and so forth, that's all kind of been removed, if you will. So that was part of it. Some of it was being hid. Okay, there was a certain percentage of it that was being hid, but then I think technology is a good thing and it's a bad thing. As we've seen social media wrap up, I mean, all of this has, in some cases, has hurt the younger population, where they've become dependent upon it, as opposed to having face-to-face personal relationships with people. And you kind of get in a cocoon, if you will, as opposed to, because at the end of the day, people are social people. I mean, they want to interact with other people, and if all you're doing is interacting with this thing, that it's going to cause problems, and I think that's part of it. And then also, just going through the pandemic has created just so many issues that we could get into that's causing all kinds of problems with children now because they were left out of school for so long, and the mask wearing and all. I mean, just
Hmm.
all of this stuff that's caused a ramp up in and various mental disorders too.
Yeah.
We've probably that pandemic has probably increased the mental health. Well, what did I say? Probably by almost 50% increased it. So, and it's going to
Yeah.
take time. It's going to take time because you've got younger people that it got kind of ingrained in them, and it's going to take time for there to be healing, if you will, and
Yeah.
supporting this.
I think you're right. It's a complex problem. I think both of the problems we've talked about today, the cost of the healthcare system or the current operating model of the healthcare system in America, and then also the mental health challenges, they're both complex, and it's going to take, I don't know, a lot to help solve them. But I like how you're focused on both of those. And I think one question I want to end with, maybe some advice out there for any parents that are raising children that are struggling with mental health problems, considering that's something you went through. Is there any advice that you would give to someone out there going through a similar situation that you went through with your children?
Yeah, I would. First of all, don't put all of your hope and trust. Not that you shouldn't have some trust, but you're going to throw it off to a third party. That's a huge mistake. So that's even if you're just very wealthy and you can afford them to go once a week or twice a week or whatever. Don't you've got to stay involved with your children and make sure that they're they're doing the things that they need to do to be successful. I mean, one of the things is in some cases, some of our children are over medicated, but others need medication. Okay, making sure they stay on their medication because if they get off their medication, the wheels will come off, and it'll cause all kinds of problems. I mean, from car wrecks to spending issues to all kinds of issues. So staying engaged with your children and kind of monitoring them is really really important, and not just placing all your hope on a third party to fix the problem. And
Hmm.
also, another thing, if you come across a counselor or psychiatrist that you don't feel is doing the job and they're not listening to you, then go find somebody else. I mean, we came into that with even with our situation because my wife, she's a retired nurse, and she would go to psychiatrists and say, "Well, I had this relative that had this same thing, and they wouldn't even listen." Well, you know what
Hmm.
we did? We went and found somebody else.
Okay.
So
No, I think it's good advice. And it's kind of a tough subject or delicate subject. I'm sure, dealing with your children, you want what's best for your kids, and something you have to learn to manage, I guess. So,
well,
but
it's an employer issue too. Also,
yeah, that's a good point.
it's definitely an employer issue because every one of their employees is impacted by mental illness in some way. Either the employee has it, or they have a child or friend or fellow employee.
Yeah, I think it ties back into what we talked about earlier. I mean, it all ties together. It's all the system that we are all a part of, whether we like it or not. If you need healthcare services in the United States, it's how the system exists today. So I think it was a great conversation. I know we're both in the industry, so I think we were able to speak to it, but hopefully it gives some insight or transparency out there to somebody, right? The everyday consumer is just like, why is this so expensive in the US? Or why is it such a pain to use my healthcare and health insurance? So hopefully somebody gleans something positive from the discussion today. And I think you have a very noble cause in what you're building and providing to the consumer and the providers, and then also in the mental health space. So it was a pleasure speaking with you this morning. I wish you the best of luck, and I'll give the floor to you to close if you have any final thoughts, and then also let people know where they can find you and more information about the companies you're building.
Okay. Yeah, first of all, again, Connor, thank you for the time and the platform to be able to do this. You can find more information about HealthQRS, that's healthqrs.com, more about the company. And you can also follow me on LinkedIn. I'm there on LinkedIn. I usually publish something at least once a month that revolves around an article. Your Safe Harbor is an existing company. We don't have the website up yet because we've got requirements now, and we're going to start building, but not long into the first quarter, there'll be a website called yoursafeharbor.org. And you'll be able to find more information about what we're building, and our plans are by the second quarter to have at least a beta out.
Sounds good. Yeah. And Earl, I'll put all that information down in the description so people can find it easily. Again, I want to thank you for your time. I learned a lot. I enjoyed it. And again, best of luck.
Thank you, Connor.